evening, everyone, and welcome.
Good evening, ma'am.
The last time I did not introduce myself and Madhvi and Vinod. So this time taking the opportunity to introduce our two organizations. This series of webinar was organized by Ananya Foundation, Ananya Child Development Center and Hi-Fi Child Development Center. Ananya is the Child Development Center is based in Hyderabad, run by Madhvi. She's here with us. Madhvi, would you say a quick hi? And Hi-Fi Child Development Center has been founded by Vinod and myself. And we are based in Mumbai. Both Madhvi and myself, we were talking one day and we decided that we should come up with some interesting topics that we would like to see and share this knowledge with all you wonderful people and therapists that are there. And that's how we requested KERRI to form a series of webinars that we could do. So thank you, KERRI, for being extremely a wonderful soul, for first of all coming forward and helping us with all these wonderful topics that you have taken up. And just some ground rules, we will keep the videos off during the presentation and the mic will be on mute. All your questions can be put on the chat. Madhvi and I will take them on alternate basis at the end of the presentation. Kindly keep all the questions related to the topic that is there currently. Yeah, thank you, and over to Madhvi to introduce KERRI.
You are mute, Madhvi.
Sorry. So KERRI SURTEE is a pediatric occupational therapist from Canada with a passion for working with kids with special needs from different cultures. She obtained her master's degree in occupational therapy from McGill University in Montreal. She has worked as a pediatric OT in clinics, daycares, and schools both in Montreal and Warsaw, Poland. She has also been involved in OT projects in Hyderabad, in India, and in Zanzibar, Tanzania. She has experience working with children who have a variety of neurodevelopmental disorders, including cerebral palsy, developmental coordination disorder, and attention deficit disorder. With a background in applied behavioral analysis, she's also particularly excited about working with children with ASD and their families to help improve daily living skills, school integration, and social interactions and play. Thank you so much. I had a chance to work with KERRI in person in Hyderabad when she was here working with Ananya. Welcome, and over to you, KERRI.
Thank you so much. So I just want to be sure before I get into it that everybody sees the slides well. Everything looks good. So I'll just give you a second. Whoops. So everything's good. If somebody needs to contact me, then they'll let me know if there's any issues. But for now, I'm gonna go for it then. All right. So yes, thank you so much, Ananya and High Five, for setting this all up, and for all of you for being here. I'm very happy to be back and to be invited for a few more even topics coming up. So today what we're doing is we're kind of getting a basis for talking about the senses and talking about sensory processing. So our plan today is essentially to go through the different senses, and here I've written 8 senses. For some of you that will be new information, for some of you that will be common knowledge, and maybe half for others. So we'll get up to date so that we're all starting from the same level. Then we're going to be talking about sensory profiles and sensory processing, which is kind of a model of understanding how we use these senses. And then we're going to, for the majority of our time together, we're going to be talking about strategies. So we'll go through some of the more common profiles, and I'll try and give you some concrete strategies that you can use to help out some of the kids in your lives. So the learner outcomes, I think you guys have seen them before, but essentially it's relating to that plan there. So understanding those senses, how they're providing us information, recognizing some of those different sensory profiles and how they can kind of have an impact on us on a day-to-day basis. You'll get, like I said, lots of concrete strategies for at school or for at home. And then at the end, we'll be talking about one tool called sensory journaling, which can be helpful in exploring those different strategies that I'll give you. All right, so let's get right into it. So as I mentioned, we're starting by introducing these 8 senses. We'll start with some senses that are very common and that you'll all know, and then we'll get into some of the maybe newer ones. All right, so we have hearing. As you likely know, we have some sound waves that are received by the auditory receptors in our inner ear. So our ear captures these sounds, and then it's our brain that's really helping us to sort out that information. So it's our brain that's sorting out, is it loud or soft? Is it high pitch or low pitch? Where in the room are we hearing it from? Is it near or far? And that's really what the part that lets us understand, you know, if we're listening to music, we can kind of hear the different instruments within the song, or if we're in the classroom, we can, you know, even if there's people whispering beside us and the window's open and there's some noise outside, we can kind of zero in on what the teacher is telling us. So hearing. The next one we'll talk about is sight. So we have our visual receptors, are receiving light in the eye. And really what they're doing is helping us to understand what's going on, what's in our surroundings. So our eye is capturing this information. And once again, it's the brain that's processing all of that information to help us distinguish between colors, between shapes and sizes of things. And definitely with sight, there's a big link with our movement senses. If you think about for babies, a very common motivator for movement and exploration is sight, is what they see, and that kind of encourages them to start to explore their environment. And we'll talk a little bit more about these movement senses there, but definitely vision is very important for skills like hand-eye coordination. So, you know, moving with coordination based on what our eyes are telling us, and other visual motor skills. So catching or kicking a ball. Writing, we need that visual information, that feedback about the shape of our letters. Balancing as well, if you think about standing on one foot with your eyes open or your eyes closed, it's a very different challenge. So sight is definitely incorporated there. Touch, so these are tactile receptors on our skin. And different parts of our body will have different levels of sensitivity. So even just if you do, as an example right now, close your eyes, everybody. You're gonna take one finger and you're gonna draw a letter on the inside of your palm and kind of think of how it feels, about how sensitive it is. And then just flip your hand over and on the back of your hand, write the same letter. And just feel the difference, feel how much less we feel, you can open your eyes, how much less you feel when it's on the back of your hand versus on the palm of your hand. So definitely the 3 most sensitive areas of the body are gonna be the mouth, the hand, and especially the palm, the fingertips, and the genitals. And so often when we have children that are seeking a lot of tactile information, it's those areas that they'll use to seek more commonly. Our touch sense is also helping us with discriminating with pressure, temperature, textures. So it's this sense that really allows us to kind of reach in our bag, even if we can't see what's in there. And just by feeling, oh, for something that's cool and hard and jagged, we can tell it's our keys in our bag. So that's kind of your touch sense all put together. The next one is taste. So we have gustatory receptors on our tongue that help us to determine between, is it sweet or sour or salty or spicy, bitter or savory. And it's definitely highly influenced by our sense of smell. So a big part of what we taste is really the smell. And taste is often blamed for picky eaters, but actually if we think about it, it's only one component of the eating process. There's also, as we mentioned, smells, but textures, sometimes it's even color of the foods that can have an impact. So that's always something to keep in mind when we have picky eaters. So smell. So we have olfactory receptors in the nose, and these really help us to determine flavors. So if you think about when you've been congested and you're eating, there's definitely a lot less taste that you're getting from your food, and that's because smell has such a big impact. And the other thing to keep in mind, especially with when we're introducing smells as a strategy, is to be aware of the emotional associations that smell can have. So if you just think of, what kind of memories are evoked when you smell your mom's cooking, maybe it's very soothing, versus when you smell an alcohol wipe, maybe it's kind of a negative experience that makes you think of a hospital. So sometimes it can be unpredictable, the reactions, and we should try and be aware of that and get to know, what kind of reactions these children in our lives are having. So we'll get into some of the senses that maybe are a little bit less commonly talked about because they're really inner senses and we're not so aware of their impact. The first one is proprioception. So proprioception is it's a sense that we receive by movement receptors that are in our joints and in our muscles. And it really gives us a sense of where we are in space, our body awareness. So if you, once again, I'll have you, if you're participating, please do. If you close your eyes and you kind of straighten out your arms and you bend them again, you're really aware of where your arms are in space. You can find your nose without looking. You can find your ears without looking. You can find your shoulders. All of this is because you have a sense of where your body is in space. So I'm going to give you a few examples about proprioception because it's kind of a newer one maybe for some of you. So if you think about climbing the stairs, the first time you try a brand new staircase, usually what you'll do is you'll make sure that you're using your eyes a little bit to help you. You'll kind of gauge how high the step is and you'll take your first step. And then, kind of maybe you're still using your eyes, you'll take your next step. But as you go up, you start to rely more and more only on your proprioception. You know how high you need to lift your leg, you know how much force you need to press onto the step to lift yourself up, and you can kind of do it with then talking or looking around or, not paying so much attention. And that's really because you're relying on your proprioception, your body awareness to get you up the stairs, which is great until there's one stair that's a little bit shorter or a little bit taller. Then you might start to stumble, and that's really because you were relying only on that proprioception. So proprioception is really telling us a lot about where our body is in space, how much force we need, so how much strength we need to use, and in what direction we're moving. So if we think about shooting a ball into a basket, we need to think about the information that our muscles are giving us on how heavy is the ball, what direction is the basket, how hard do we need to push to get that ball in the air, and that's all from our proprioceptive sense. All right. And then the next kind of movement sense that we'll talk about is our vestibular sense. So this is another sense that has receptors in our inner ear. But the receptors are movement receptors. So they can pick up on the movements of our head in space. And this gives us a really good idea of balance. This really is what helps us to stay balanced, to keep our head upright. So some examples, and then we'll talk about a little bit more the visual system, how it's connected. So some examples would be if you're in an elevator. So an elevator is a tricky place because your eyes are telling you that you're in a box, that you're not moving. And yet, as soon as you press the button and you go up or you go down, you speed up, you slow down, you're aware of it. And it's that vestibular sense that's giving you that information, that your head is moving in space, up or down, fast or slow. So it's not just up and down, fast and slow, it's also rotations that are picked up. So if you think of a gymnast or a figure skater, or Olympians have very often very good movement receptor processing. So if we think of a figure skater, they would be able to spin however many times they need to spin and know where their head is in space, know exactly when they need to pull out of that spin because they're quite attuned to this information that they're getting from their vestibular sense. And one important thing is that, as I mentioned a little bit before when we were talking about vision, there's a really strong connection between our vision sense and our vestibular sense. And this is because when our head moves in space, so when our vestibular, when we get this vestibular information, it communicates also with our eyes to make sure that our eyes are staying still so that we can see what's around us. So if we didn't have this nice communication, essentially our vision would look a lot like when we give our phone or tablet to a child and they're doing a video chat and it's kind of wiggling all around and we're trying to see what's going on, but honestly it's very difficult to even understand what the child is saying because we're so distracted by all of that movement. That's because they don't have that, you know, their arm doesn't have the same connection to their vestibular sense as their eyes do. So we're very lucky to have that sense, because otherwise I think a lot of us wouldn't be feeling too well all the time. It would make us quite busy. All right. And the last of the new senses that I'll talk about, maybe new for you guys, is interoception. So this is a sense that receives information really from all over the body. And it really gives us an idea of how what's going on, what's our inner state. So there's some receptors in our stomach, in our bladder, in our heart, and in our lungs. And it gives us information about how we're feeling. Are we hungry? Are we thirsty? Are we too hot? Are we too cold? Do we need to go to the washroom? So those are all picked up by this interoception sense. All right, so you guys have made it through those eight senses. And so what we're going to do now is we're going to try and we'll talk about the next step. So we all have these 8 senses, but it doesn't mean that we're all seeing the world, or I say seeing, but I mean understanding the world the same way with these senses. So we're going to talk about sensory profiles and sensory processing. One thing that I want to mention before we get into this is that this whole process is not fully understood, and sensory profile specifically is a theoretical model. There's a few different models for trying to understand the senses. None of them are perfect. This is one that I find rings true to me, but there are others. If you're interested, you can always mention it at the end. So I just wanted to make sure that we have that in mind when we're going into this, that it's not, these things aren't necessarily set in stone. All right, so for the interest of our presentation, I'm just gonna talk like that about this model, but just keep in mind that as we continue to get information, maybe some of this information will change, or some of these things that I'm telling you. So sensory profiles are essentially, they were developed by an occupational therapist called Winnie Dunn. And for her, it's how we process and how we respond to the sensory information that we're getting from our senses throughout the day. And there is lots and lots of variety in different profiles. Certainly some people can have similar profiles for many of their senses. Some people can have very different profiles from one sense to the other. And some people can have, even within one of their senses, can respond differently at different times of the day, or depending how they're feeling. So there can even be variation within one sense. So the first step that we're going to talk about when we're talking about these profiles and processing information is registering the information. So how do our senses receive this information? And essentially this is at really what we should be saying is, at what point do we receive the information? So different people receive the information at different points. For some people it takes more information before they become aware. For some people it takes less. So we'll start over on the left-hand side. We have this low registration or hyposensitive. So these would be people where it takes them a lot of information from whatever sense we're talking about, and we'll get into some examples, but it takes them a lot of information before they're even aware that that sense is being stimulated, okay? At the other end, on the right-hand side, you have high registration or hypersensitive. So that would be somebody that notices very quickly when there's sensory information in their environment. So they pick up on it very fast. All right, so let's give some examples to make this a little bit clearer. So this is the little girl that we had when we were talking about proprioception. So let's say that on this kind of scale here, that we have somebody that has very low registration or that's hyposensitive for proprioceptive information. This might look like somebody that's quite clumsy, that's walking into things or not really aware of their body and space. It might be somebody that, you know, when they're holding their pencil, they're pressing really, really, really hard because they just don't feel their pencil in their hand, and the only way they feel it is if they really press hard. Or somebody that gives really big, tight hugs because, again, they don't notice how much force they're using. So that would be somebody that's low registration or hyposensitive for proprioception. What about for visual? So here we have somebody who's a little bit more towards the high registration or hypersensitive for visual information. And what this can look like is somebody that's easily distracted. So if I get a haircut, they might say, "Oh, KERRI, you changed your hair." They notice it right away. It might be somebody that's quite disorganized when there's a lot of posters in the classroom. So they might be, you know, so overwhelmed by the visual information in the classroom that it's hard for them to know what's important and what's not. It might be somebody that's sensitive to lights as well, so squinting or preferring dark. Here, so we have our taste, and we have it kind of towards the lower registration or hyposensitive side of things. So that might look like somebody that needs a lot of spice and a lot of flavor before they kind of pick up on it. Maybe they don't enjoy foods that don't have a lot of taste in them. They really need crunch and spice to get that information. So touch, and we're talking about the high registration or hypersensitive. So this might be somebody that's bothered by tags in their clothing or clothes that are too tight or that have belts. It might be somebody who doesn't like messy play, so playing with plasticine or playing with paint, they don't like it. Or maybe somebody that's very quick to wipe their mouth or wipe their hands when they're eating because they don't really like that feeling of having messy fingers or a messy mouth. Here we've put the smell, and we've put it a little bit towards the low registration. So this might be somebody that doesn't really notice maybe if the garbage needs to be taken out, or, you know, if we have a full diaper, you know, some people will notice it right away. Well, somebody that's a little bit towards low registration might not pick up on that information. Vestibular. So if we're saying vestibular is a little bit higher registration or hypersensitive, that might look like somebody that has quite good balance. Maybe somebody that really enjoys swinging or spinning. Or as it gets higher and higher, it might be somebody that's a bit, it's too much for them. They might get car sick, or they might not like going on rides because it's just overwhelming, overstimulating. And then our last one is this interoception. So interoception, and we're saying that it's a little bit lower registration or hyposensitive. So this might be somebody who doesn't notice that they need to use the washroom until the very last second. So there might be a lot of accidents. It might be somebody that keeps on their sweater even when it's really hot. They don't notice that it's too hot. It might be somebody that eats and doesn't really notice when they're full. They're always asking for more food. So that would be that hyposensitive for interoception. So I hope that registration part makes sense. And then I'm going to go on to the next step of things. So the next step, once we've registered the information, we need to kind of understand what we're going to do with that. So we have our modulation and our response. So this is kind of how we organize ourselves, how we react to that information that we're getting. So when we get this information, does it make us more alert? Does it make us more calm? Do we have a really big reaction, or do we not really react at all? So it's really how does this information change our behavior. Somebody that has really good, really appropriate modulation and response to sensory information would be really able to respond appropriately to sensory information, to remain at a good level of alertness throughout all of the day. And this would look like very good self-regulation or sensory modulation. Self-regulation is something that I'm going to be talking about next week on Friday, if you're available, and we'll get more into that now. We'll get more into that then. But essentially, that's what we're talking about this, how alert we are, how big of a reaction we have. So what we're going to do here, this is, I promise, the most complex slide that we have. It won't get worse than this. I'm going to take you through it slowly, so don't panic. So here what we've done is we have these two components kind of put together in a table. So on the left-hand side, we have this sensory threshold that we were talking about, okay? So we have some kids that are very high registration or hypersensitive, and we have some kids that are very low registration or hyposensitive. They don't pick up on maybe what's the information as quickly. And if we think of it as a threshold, when we have a high threshold, it means that it takes a lot of information, lots of things maybe shooting around, and they just don't receive that, they don't pick up on this information. So this high threshold, would be a low sensory registration or hyposensitive, all right? And somebody that has a very low threshold would be something that every single stimulation that comes in, they're receiving it. So they're hypersensitive, they're high registration. All right, so we're taking that left side and we're combining it with this behavioral response that we just talked about. So some people that are more, they have a bigger response, and some people that don't really seem to respond at all. So we have the active responders and the passive responders. All right. So we're taking these two ideas, and essentially what it's giving us is some different sensory profiles. So we'll start with the top left, the bystander. So a bystander is essentially somebody that's high threshold, which means that it takes them lots and lots of information before they pick up on what's on what's going on in their environment. So they're low registration and hyposensitive, but they're very passive. So for these kids, it's very hard to engage them. They need a lot of stimulation from outside. They won't go and seek themselves, and they miss a lot of what's going on around them. They kind of just, as the name says, bystander, they kind of just wait for things to happen. We'll go on to just underneath that, so the bottom left, the sensors. So here we have, again, a passive reaction, so a child that's not reacting very much, and yet they are very, very sensitive. So what happens here is it's a child that they pick up on all the information that's happening, and they just kind of keep it to themselves. And these are very difficult children to work with, because we don't always notice when things get overwhelming for them. And often for these kids, it turns into a sensory overload. They kind of keep the information until they can't anymore. It's the straw that broke the camel's back, and we have a big tantrum, and we're kind of wondering where that came from. Well, it's that they were keeping all of that. They perceived all the information, but they just didn't react to it. So that can be tricky. We'll go over to the right side. So active responses are much easier to pick up on. So on the top right, we have the active seekers. So these are kids that have a very low registration. So they don't pick up a lot of the sensory information in their environment. And so to compensate for that, they're looking for it anywhere they can get it. So these are kids that are, touching things all around them, that are wiggling all the time, very busy, very active, and they're really engaging as much as they can in sensory activities. And then at the bottom, we have the avoiders. So again, these are very active children, but they're very actively blocking out as much sensory information as they can, because it's too much for them, because they receive way too much. They're hypersensitive. So these kids are retreating, they're tantruming, they're pushing away when we try and explore different sensory activities with them. All right, so you've made it through these 4 profiles. We'll go into more details and more examples with them in just a little bit, but we'll just finish talking about sensory processing. All right, So sensory processing is essentially, when we're able to do it well, we're effectively receiving this information or registering this information, we're organizing it, understanding it, and then we're responding to it throughout the day. And one thing to remember is that nobody has perfect sensory processing for all their senses and all the time. Everybody has variety throughout the day. Sometimes it can be, you know, our processing can be affected by our emotions, by how stressed we are or how tired we are. Sometimes it can be affected by how much control we have on the situation. So if it's me that's, you know, making the loud noise, then it doesn't bother me because I can predict it. But if it's somebody else, then I might get more sensitive. So those are also aspects to consider. And I'll just mention now, I'm using sensory processing rather than sensory integration, just because I prefer not to use this term because it can be kind of confusing, because it's really often associated with a specific therapy approach called sensory integration therapy. My goal right now is not to train you guys in sensory integration therapy. It's to give you an overview on what are the senses, what is sensory processing. So I've chosen not to use that term, but you'll hear it. Sometimes sensory processing and sensory integration are used interchangeably. All right, so we're gonna go over a little example, hopefully to make things crystal clear before we get into our concrete strategies of sensory processing over the day. So what we have here is a chart, all right, and we have some different thresholds, all right. So right down the middle, this green level would be a regular, a typical, you know, in the middle sort of threshold. The pink line at the bottom would be hypersensitive threshold. So it's a very low threshold, which means that every time sensory information comes in, that child is receiving it, that child is perceiving it, okay? And then right up at the top, this blue line is hyposensitive. So that means that it takes a big stimulation before that child gets the message, before that child understands what's happening around them. So we're going to take the example of a child that's hypersensitive or high registration. So that pink line, they're receiving lots and lots of information for touch, okay? And this is going to be our example as we walk this child through the day. All right, so the first thing, the child wakes up in the morning and they're given, you know, they're asked to get dressed and they're given a pair of jeans to wear. Okay, and for some children, they put on their jeans, maybe they feel a little bit once they put it on, and then they completely forget that they're wearing them, and it's not even on their radar. But for somebody that's hypersensitive, that pair of jeans might stay there and present and be an annoyance for a very long time. So it's already at their level at their threshold and already kind of a presence for a long time in the day, okay? But so for this child, so they put on their jeans and they're not very comfortable already. It's already a lot for them or too much for them. Then they go off to, we'll say they go off to preschool and they have a finger painting activity. For some kids, this might be very enjoyable, but for this child, when we're talking about hypersensitive, it might be a lot for them. So already this, you know, with the accumulation of the genes and this finger painting, you can see that we're way above this child's tolerance. Already we're going to start seeing them washing their hands, trying to push away from the activity, saying that they're finished. They're not enjoying this at all. All right. So here we're seeing this child start to have some behaviors that we might say are, you know, problematic. They don't want to participate. But here we can really understand that it's this accumulation through the day. And then let's just say that towards the end of the day, you know, some of their friends come to give them a big hug goodbye, and it's way too much information from them, and you see the child push away their friends. You know, maybe somebody gets hurt, and we start to think of that child as maybe an aggressive child. But if we look through the day at all those accumulating factors, we can understand that it's not. It was that they didn't know how to get themselves out of the situation. That was far too much sensory information for them. So again, you know, it's this straw that broke the camel's back, or maybe you have saying, but essentially it's the too much. And so we need to be thinking about, when we see one of those, a problematic behavior, we need to be thinking about, was this an accumulation of activities through the day that might have been overwhelming for the child? All right. Okay, so we've been talking about this, senses, sensory processing, and likely when I've spoken about some of the examples, you guys have been thinking about maybe even yourselves or a child that you know that have similar behaviors. And so it's possible that does this child have sensory challenges? One thing that we really need to remember is that there's a wide range of normal in sensory processing. Okay, and the simple answer is, in many cases, it's not a huge problem. In many cases, whatever our sensory profiles happen to be, we've probably found some strategies. So if we're a bit more sensitive to sound, well, we know that we need to turn down the volume of things, or close the door or close the window so that there's less noise. Dim the lights if lights are overwhelmingly bright to us when we're tired. Maybe we know that we prefer lots of spice in our food, so we just do that automatically, and it's part of our sensory profile, but we don't even really think about it. So very often we just need a few strategies and adaptations, and very often for children, even children that have still within the range of normal sensory processing or sensory profiles, very often if we help them to explore more appropriate strategies or more appropriate adaptations, they're still able to function very well in their lives. So maybe they just need a few little tricks and strategies. However, for some children, this isn't the case. And when we're talking about really it being a problem, it would be when we have a long-term issue, and that it's impacting on day-to-day life regularly. Okay, this is what we might call a sensory processing disorder. One thing to keep in mind is that especially for younger children, there can definitely be phases, and maybe some of you will remember either working with younger children or your own children that, there was a few weeks or even a few months where certain clothes were more difficult or certain foods were more difficult, and the child kind of grew out of that phase. When we're talking about a sensory processing disorder, it would really be long-term, so not just these little phases. And these functional impacts would be on their relationships, on their learning at school, on their daily living, their behaviors. So they're not able to play with friends, they're not able to eat well or dress appropriately for what they need to do in the day, or participate in school appropriately. So if you have a child in your life that has those kind of long-term functional impacts, then I would definitely say that's the point that you would want to speak to a therapist or a professional. And there's definitely some debate on sensory processing disorders. Right now, there's no clinical diagnosis. And this was decided because often these sensory challenges are seen along with other diagnoses. So as a feature of, for example, attention deficit disorder or autism or cerebral palsy or Down syndrome or intellectual disabilities, prematurity. So often we're seeing them along with those. And so there's no formal diagnosis now, although there are definitely groups that are talking about sensory processing disorder, and it can be very helpful just to know the term so that you can connect, online with different information in different groups. Okay. All right, so we have made it through the big theory, and now we're going to get into exploring some of the profiles. So we're not going to go through all of them we won't have time to go through all of them. So I've chosen kind of the ones that are, that come up more often. At the end, you have a few resources. So if you're looking for a specific profile that we didn't talk about, you can check out those resources. And then the one other thing that I wanted to mention is that when we're thinking about these strategies, we just need to keep in mind that approaching a problem with a sensory idea in our head is one one way of thinking of things, and that definitely, or one approach to the problem, and definitely there's other approaches. So just keep that in mind, that it's often we need to do a sensory approach along with, say, a behavioral approach. So that's definitely something to have in the back of your mind, that these strategies often go best when they're accompanied with other approaches too. Okay, so we're going to go into general strategies, and we'll start with these bystanders and these seekers. So these are children that have a very high threshold, which means that they're hyposensitive and under-responsive, and they don't have a lot, they don't pick up on a lot of information that's in their environment. So general strategies for these kids would really be to try and meet their needs if they're seekers, or try and provide them with experiences if they're kind of just bystanders that don't seek out for themselves. So we want to be giving them regular experiences throughout the day, and we want to be thinking about giving them a variety of experiences. So a variety of durations, of intensities, for these different, to meet these different sensory needs. Okay, so if we think a child who's constantly asking for big hugs, well, maybe, so we can think big hugs is this big deep pressure, maybe they're liking that squeeze of their muscles, using their muscles. So we can be thinking about proprioception and maybe a little bit of tactile as well. And maybe what we need to be thinking of is not just giving them hugs all the time, but trying to think, is there something that we could give them that would be a longer duration, because the hug doesn't last so long. So maybe they need, you know, a spandex clothing underneath their kurta, and that will help them to kind of have that tight squeeze. Or maybe they need a beanbag chair to sit in, and that could be their tight squeeze. So that would be kind of a longer duration. Or intensity, if we think about a child that's, you know, touching and manipulating everything on the table all the time, well, maybe they just need more intensity. So maybe we can do vibration on their hand that would be really intense, and that might meet their need better. So be thinking about that duration and intensity as we go through some of these. So we'll start with these oral bystanders and seekers. So when I'm talking about oral, we're often thinking about just the mouth, but there's a few different senses that could be involved there. We talked about taste, we talked about smell, there's the texture in our mouth, and there's also proprioception when we're talking about these chewing, children that have behaviors of chewing on things. That might also be a component of these oral seekers, all right? So what this might look like, a child that's an oral seeker might look like a child that's sucking, biting, chewing, or licking on things that aren't food, like their pencil tips, like their shirt sleeves or collars, like toys around them. They might prefer really strong flavors, or, you know, hot, or cold foods. They might be overfilling their mouths without really noticing. They might not notice when their mouth is, when it's messy around their mouth, or when they're drooling. So these might be indicators that the child is an oral bystander or seeker, okay? And some strategies that we can do. So we definitely want to give them lots of texture, lots of flavor in their snacks and in their meals. So this could be crunchy, you know, raw vegetables, or chewy dried fruits, nuts and seeds. We might want to give them safe, chewable objects. So there's specific, you know, teething toys, or special tubes, special necklaces that children can chew on, or special pencil tips that are made to be chewed. So that could be an option. Games where they need to blow, so blowing bubbles, blowing, you know, a kazoo, blowing feathers, blowing a cotton ball through a straw. Maybe you've seen that kind of activity. So that those can be also activities to encourage these children to do. Drinking thick liquids like lassi through a straw could be a really good strategy as well. And vibrating around the mouth, so a vibrating toothbrush is often an easier one to integrate. There's also definitely, under the guidance of an occupational therapist, there might be massage around the mouth, or different vibrating tools like nuke brushes that can also provide that information. So here you have some examples. You have on the top left these chewable tubes. that are made to be chewed and have different textures or different resistances. You might try frozen grapes because that cold with the crunch might be interesting. The vibrating toothbrush as we're going towards the right. The different gum, sometimes that can be, you know, if it's a child that we know that it's helpful for, the school can sometimes be more willing to implement that in the class. So you can work on it a bit at home and then see. A chewable necklace, one that's made specifically to be chewed on. Even just drinking from a iced water, it could be from a water bottle with a straw, and different. They have different games or musical instruments. Okay. The next group of, or the next profile that we'll talk about is these movement seekers or movement bystanders. So again, these are kids that are not getting enough information from their movement senses, so they're under responsive or under sensitive, hyposensitive. Okay, what this might look like is a kid that's constantly fidgeting, moving around, jumping, or climbing up things. Sometimes they're doing a bit more risky play. They might be kind of accident prone, falling and tripping. They might be holding things too tight or even too loosely because they just aren't sure what's going on with their hands. They might be kids that are rocking or spinning around themselves. And some strategies for these kids. So definitely one thing that we want to explore is giving them heavy work opportunities. So I'm not telling you to make your children work. I'm telling you to have your children explore different activities where they need to use their muscles quite a lot. So things like pushing against the wall, doing push-ups, pushing, their brother or sister in a box across the floor, pulling, carrying. So it could be, carrying a grocery bag, putting up chairs and taking down chairs at the end of the day at school, or erasing the chalkboard or the dry erase board. So those are lots of big muscle activities. It could be also sharpening pencils in a manual pencil sharpener. That's a lot of muscle strength that we're asking for. Carrying heavy library books in the classroom. So it can be very helpful to include activities that they do every single day and just kind of stick them in throughout the day so that the child has a little bit of stimulation at regular intervals through the day. We want to be looking at swinging, spinning, rocking, those kind of activities that are very vestibular. Exercise type activities, whether it's stretching, whether it's yoga, jumping, doing jumping jacks or jumping on a trampoline, running, dancing. I know at home there's tons of dancing Just Dance or YouTube videos that the child can dance along with. Animal walks, especially when we have our hands and legs on the ground at the same time we're pushing through our arms and through our legs. That can be really interesting. And then deep pressure is another thing to explore when we have these movement seekers. So deep pressure can look like a massage where we're really massaging the muscles and we're giving stimulation to the muscles. So we're talking about a stronger massage, not a more tactile massage. It can also look like, as I mentioned before, spandex clothing or lycra clothing. So that can be, sometimes they have these bathing suit kind of tops that a child can wear underneath their clothing that might give them the sensation of a deep squeeze. A weighted object, definitely I would say this would be put into place under the guidance of an occupational therapist just to make sure that it's appropriate for the child and that the weight is appropriate to the child. But this could be, there's definitely specific weighted objects, but it could also be, a bag that's filled with beans or with rice, and that's just kind of sat on the child's lap to help kind of calm them a little bit. Okay. So another thing when we're talking about movement bystanders and movement seekers is talking about alternative seating. So often we see issues with these children when they have to sit for a long period of time. So then we can be thinking about giving them different options for sitting. So on the top left, you have this, the ball chairs, the therapy ball chairs. Underneath that, you have a beanbag chair, which can be comfortable if the child is doing something that doesn't require a desk. So maybe reading a book. in the middle, the two pictures in the middle go together. So essentially what you have is these TheraBands, which are just therapy elastics. If you don't have these therapy elastics, it can also be just medical bandage, like if you have a sprain or something like that and you wrap with medical bandage, or it can even be just a pair of tights that you're tying either on the back two legs of the table in front or on the front two legs of the chair. And essentially it gives a little bit of resistance that the child can kick their legs against while they're sitting. So they get a little bit of movement, but they're still sitting. And then on the right side, you have these, there's a bunch of different names for them, but they're essentially just cushions, air cushions, that we can put underneath on the seat or even under the feet. And essentially some people call them wiggle seats or proprioceptive discs or balance discs. And essentially they're giving the child the opportunity to wiggle a little bit, move a little bit, but still stay sitting. So those can be options for these movement seekers. So then we'll get into tactile. So touch bystanders or touch seekers. All right. So this might look like children who are touching all the time, anything they can get their hands on, people, objects around them. It might also be kids that don't really notice when their shirt is tucked in or twisted on the side, when their sleeves are all wet. They don't really pick up on that information. Okay, so here's some strategies that we can do with these kids. So one could be sensory bins. So I'm sure you've seen them. If you don't know what I'm talking about when I say sensory bins, then go ahead on Pinterest. You'll find lots of examples. You can fill a bin with rice, with sand, with beans, and just have the child explore. It can also be, a sandbox. We can have the children engage in messy play. So whether that's, playing with shaving cream, with flour, with finger paint, roti dough. You can have them doing your roti and playing with it and manipulating it and rolling out. That can be a really good tactile activity. Massage, this would be when we're talking about more of a gentle massage, so different textures, different brushes, things like that. And fidget objects, which I'll show you some examples, but these are essentially objects that we're giving to the child and explaining to them specifically that this is a tool for them to help when they want to touch and manipulate everything. This is what they're allowed to touch and this is what they're allowed to manipulate, okay? And it's often we want to introduce it quite structured like that with specific rules so that it's not just understood to be a toy, and other kids in the class aren't just jealous of it, but the child understands that it's really a tool for them. So here's some pictures to go along with these strategies. So we have on the top left, you have just a handheld vibration massager. Underneath that ball is kind of a textured stress ball with tiny balls inside. You have brushes to be thinking about massage. In the top middle, you have a fidget. So it's kind of a band that can just be manipulated and also be different pieces be snapped. So they're kind of, each little color is a different piece. Underneath that, you've got these rings of different colors. These are finger massagers. And they can be kind of rolled up and down the finger, and they give a lot of feedback on those fingers that are very high sensitive places. You have on the top right, you have fidgets for the top of the pencil. So they kind of look like tools, like nuts and bolts, and they spin. And then underneath that, you have, just as an idea, a kinetic sand or magic sand. There's definitely all sorts of new textures and things that you can explore. But like I mentioned, it can also be beans and rice and things that you might have easy access to. All right, and then the last of the interoception seekers or bystanders, the last of the seekers or bystanders that we'll go through is interoception. So this might look like a child that has a hard time with toilet training or that has frequent accidents because they're just not picking up on this information from inside their body. They might be not really asking for food, or the opposite, constantly asking for food or constantly asking for water. And they might not notice when it's too hot or too cold for their body. And I just want to remind you all that not every child, for example, who has difficulty toilet training has low registration for their interoception. Okay, there can be lots of other reasons why a child might have a hard time to toilet train. It might be, just emotional immaturity. It might be their motor skills. It might be the understanding or their motivation to do toilet training. So we just do have to keep that in mind every time I say this might look like these are options, but it doesn't mean necessarily that if you have that behavior, the child has this sensory profile. Okay. All right, so interoception is definitely a new domain. We're still exploring what are the best strategies, but there is some belief that if we help the child to bring some awareness to the inside of their body, that can be really helpful. In Indian culture, you have a few of these different ideas that are quite common in your culture. So things like yoga and mindfulness and breathing activities can all be ways of helping the child to kind of turn in and focus on what's going on inside of their body. So for some children, that will be appropriate. And for other children, that maybe aren't at the level of body awareness, then we might be more relying on compensatory strategies. So things like giving them visuals or using timers or schedules to remind them, when it's time to eat or when it's time to use the washroom. Okay. All right, so we've made it through all of the seekers and the bystanders. Well, the ones that we're talking about today, and as I mentioned, if there's one that I haven't had time to go through, then there'll be resources at the end that you can take a look at. We're going to go into the bottom part of that little table. So the kids that have a very low threshold. Okay, so they're noticing everything. They're hypersensitive. They're highly reactive. So these are going to be the sensors and the avoiders. Okay, we'll go through a few different strategies and then we'll go into specific profiles. So the main strategies that I would say for these kids, these sensors and these avoiders, are to try and use a lot of warnings before the stimulation. So if you want to, for example, brush a child's hair, you want to try and approach them from the front, let them see that you're holding the brush, what you're going to do, so that it's not a surprise for them when they get this sudden sensation. Okay. We want to try and give them as much choice as possible. I know that it's not always possible for all situations, but when there is an option, we'll try and give them some more choice. So which toothbrush you want to use, what color food, what color fruit do you prefer, what clothing they're going to wear, and that's it. We want to try and give them some of the control. Okay, so maybe they're going to do things a little bit more at their pace. Maybe we need to give a little bit extra time so that the child has some sense of control, because it can really play on how stressed they are in the situation, which we talked about already, can really impact how sensitive they are. Okay. And of course, when it's possible, we want to try and limit the sensation. So we'll go through a few different strategies for that. So these are main strategies, and there's one more really important main strategy that we'll get to next, which is desensitization. Okay, and for those of you that were at the previous time that I spoke a little bit about desensitization. I'm going to talk about it again, and I'll give you some examples again. So desensitization is essentially slowly introducing a child who's sensitive to the sensitive experience, okay? And we're giving them time to get used to it over a longer period of time, okay? So we're essentially ranking, as you can see in the little picture here, we're ranking experiences very, very, very stressful, or very, very, very sensitive, or a little bit less stressful. We're ranking them, and we're kind of gradually increasing how much contact we have with that activity. So sometimes we're gradually increasing the time that we spend during doing that activity, or how close we are to a stimuli, to a sensory experience that we don't like, or we're getting, the texture is getting rougher and rougher and rougher, the size of the bite that the child needs to take is getting bigger and bigger. So we're gradually increasing And throughout the whole experience, throughout all of these steps, we're always checking in on the child's level of stress. So we're not forcing them to make it through each step. We're really trying to go at their pace and make sure that at each step, they've had time to calm down and that they're so used to this step that they don't even really notice that it used to bother them, okay? I would say definitely that desensitization is something that's best done in collaboration with a professional, just to help set those benchmarks, those steps that we take, and to make sure that the step is a challenge, but not too much of a challenge for the child, okay? A just right challenge. All right, so we're gonna go into some specific strategies for these sensors and these avoiders. So we'll start with oral. So kids that are sensitive or that are hypersensitive, so that are really picking up a lot of information on what's going on around their mouth. So it might be the taste or the smell or the texture in their mouth. It might be the proprioceptive input from their mouth. So if it's too crunchy or if they have to bite too hard, it might be uncomfortable for them. These might be children that prefer really bland, room temperature foods, or only a certain texture, so only crunchy or only soft foods. It might be children that don't like getting their teeth brushed or dental work at all. It might be kids that have gagging reactions or are spitting out food as well. And again, remember that these are possible behaviors that you might see. There might be other reasons as well for those kind of behaviors. So what strategies can we use? Well, definitely we can try and limit how much sensory information that child has. So we can give just a little bit of spice in their food, or we can always use the same textures. And another strategy that we can use is desensitization. We can do desensitization for the textures of the food or the amount of food. So we can start, if a child like softer food, we can start with a cooked carrot and slowly reduce how much we're cooking it until they're accepting to eat a raw carrot. With the quantities, we talked about the different sizes of food. It could be a small bite or a bigger bite. Toothbrushing too, we can use desensitization, so it could be the amount of time. Maybe they just have to touch the toothbrush to their mouth for 1 second, and we can slowly build up to the 2 minutes that dentists are recommending. For those of you that were here for my last presentation, I'm sorry if this is repetitive. I'm going to just see if this video is working, but essentially in the video what you have is a child that's doing a desensitization for vegetables. So she wasn't very keen on the texture of tomatoes. And so we had kind of started with just having her touch the tomatoes and then going on to smell them. So we're going from the bottom of this set of pictures that's on the right hand side, this column. We're going from the bottom up, so touching it, smelling it, licking it, kissing it, biting it, and then towards eating it. And what you'll see in the video, if it's working, is that she actually accepts it really well. So I'm sorry if this is repetitive for some of you, and for others I hope it's informative. And then we're gonna give it a lick. And then we do a little bite. Oh, nice job. Can you find some seeds in there? Wow. All right. Perfect. We'll go into tactile sensors and tactile avoiders. So what this might look like is a child that's, refusing certain clothing, especially clothes with tags or clothes that are too tight or certain textures. It might be a child who has a hard time to stand in line with the others because they don't like that, unpredictable touch of somebody, walking by or being close behind them. It might be somebody that's avoiding, playing with Play-Doh or playing with finger paints, somebody that's washing their hands or asking for a tissue after or many times during the meal. So some strategies that we can use for these children are things like tagless clothes or seamless clothes. So you have some seamless socks there in the picture. As I've mentioned already, lycra suits or spandex suits that they can wear under the clothes. This essentially is the same idea as if we, if I bang my elbow and I rub after it, I'm kind of, trying to distract my brain by giving it lots of information all around the part that's bugging me. So this is the same idea. If, my tag is always bugging me, I'm really sensitive. Well, sometimes having something that's tight and not moving is giving a lot of information around so that I'm not focusing so highly on just that one annoying part. So again, we want to be doing really firm touch, deep pressure activities, because often it's that light touch that's overwhelming. And again, we can be doing desensitization activities. So it can be things like messy play. We might ask them to, start painting, wearing gloves and using a paintbrush, and then slowly work towards finger painting. For clothing textures, we might ask them to wear their jeans just for 5 minutes while they're, singing a song, and then work towards wearing jeans for the full day, if that's appropriate. For kids that are sensitive or avoiding auditory information, what we might see is them blocking their ears or being really distracted, and it might be distracted by noises that we don't even notice. So the humming of a fan or the humming in the fridge, we might not even hear it, and yet the child is distracted just from that. So we need to be thinking about that a bit. They might react really strongly to sudden sounds. So, fire alarms or car alarms might be really a really stressful situation for them, and we might see, a tantrum or a big reaction. And they might be fearful of certain environments because they associate it with a loud noise. So they might be too scared to use the public washroom because there's that automatic flush, or too scared to, go into school because there's that bell that might ring. Okay. So some strategies that we can offer these kids would definitely be something to block out, to limit some of the information. So, wearing those noise cancellation headphones, or if it's a child that's, that has the understanding and the safety to wear earplugs, giving them just an area, a quiet area that they can go to if they're feeling overwhelmed. So this little tent is an example, but it can also just be a little corner in their room where we know that if they go there, we're going to try and leave them alone and give them time to be quiet and to calm themselves down. We want to, as much as possible, try and warn them before there's going to be a loud noise. So if you know that you need to vacuum, then you might tell the child, look, I'm going to vacuum. It's going to last, 10 minutes, 5 minutes, and then it'll be finished. So let them know that it's coming. And then again, we can be using desensitization strategies. So as I mentioned, the vacuum, for some children, they're scared just to see the vacuum because they know that it makes the loud noise. So we might just have them, get used to the vacuum around them. They might play and we'll just take out the vacuum beside them. And then we might work towards them coping, maybe turning it on once themselves and then having it turn off, and then, longer and longer. Or alarms, again, we might start with a video, a YouTube video of an alarm that they can turn on and turn off, and we can even play around with the sound, keep it quieter and then get to louder, and then work towards, a real alarm in the house maybe. And flushing the toilet as well. We might start with a situation where they can control, so in their own bathroom where they can flush, and then work towards a little bit less control, so maybe in their own bathroom but you're pushing the flush, and then work towards these automatic washrooms that can be stressful for some children. And then we have visual. So visual sensors and avoiders. This might look like kids that are squinting often, or they're closing their eyes. They prefer to have the lights off or dark rooms. They're really distracted in situations where there's lots of visual information. So in a classroom where there's lots of posters, or in in a shop where there's, different colored toys or food or whatever it is, that can be really stimulating. They might also avoid eye contact. And once again, avoiding eye contact, I just want to mention this again so that we remember, avoiding eye contact doesn't mean that a child is a visual sensor or a visual avoider. It's one possible characteristic, but there can be other reasons as well for avoiding eye contact. So sensory strategies for these kids would be to limit the information. So dark sunglasses, giving them a baseball cap or a cap with a wide brim to kind of cut out some of the light or even some of the glare that they might be seeing. Sometimes it can be helpful, instead of having these overhead, especially the fluorescent kind of lights, we can just give them a small lamp at their desk or in their room, and that could be more comfortable. Before we open the curtains or before we turn on the lights, we can try and give them a warning. We can ask that there's reduced clutter in their classroom or limited visual information in their classroom. So that might be, you know, a bit being in a place where there's a few less posters, or even having one of these boards, as you can see in the bottom right corner. This can be, you know, put at their desk to kind of block out some of the, you know, some of the information. And again, we can be using desensitization. So it might be for their schoolwork that at the beginning we're giving them only one question per page and the rest of the page is blank, or even giving them a blank page that they can cover part of the page with, and then slowly more and more information on each page. Okay. The last thing that I want to talk about, and then we'll get to questions, is sensory journaling. So essentially what I've done here is I've given you lots and lots of strategies for different sensory profiles. And one of the things that can be really overwhelming is knowing which to use and knowing which is, you know, which is the best for each child. Because unfortunately, there's no magic best answer. There's a lot of trial and error that needs to go into the process of understanding a child's sensory needs and getting their personalized sensory strategies. So this sensory journaling is one tool that you can use to kind of start with your exploration, okay? So essentially what it is a chart. It actually looks very similar to an ABC chart, if that's something that you know already, which is a chart that's used for understanding behaviors. So essentially we're using a chart, a sensory journal, to understand sensory behaviors, okay? What we're doing is we're choosing one behavior to target at a time, and we're kind of going through the chart. Okay, and we'll go through an example together, don't worry. So your behavior might be something like staying seated during meals. That might be a problematic behavior, and you're wondering, can I explore some sensory strategies to see what might help my child? Or it might be a child that's bringing everything to their mouth. They're chewing on a lot of you know, toys and things like that. That might be something that we want to explore using a sensory journal. Touching other people, can we go through strategies to help with that? So really you need to choose one specific behavior, and then you're going to kind of go through the slides that I've given you with different strategy ideas and start to explore and try and see patterns by noting down what's going on before, how does the child react after, what is their state, how long does that last for as well. And this can be a really helpful tool to have between home and school, or between home and therapy, because it can help, you know, see patterns in different environments. So we're going to do one example together. This is an example for a child that's having a hard time to stay seated during a meal, okay? And just for the sake of the example, essentially what I've done is, you know, we've got 4 different days. So we'll say Monday, Tuesday, Wednesday, Thursday, and every single day the time is the same where we're having this difficult behavior. The place is the same. So it's at about 12:30, lunchtime in the kitchen of this child's house. And right before, just for the sake of this example, the child has a very strict routine right before they were outdoors doing some free play at the park. Okay, and then as soon as they come in and we sit down for the meal, this is where we're having the kid wiggling around, fidgeting, getting up, moving, all sorts of difficulty to stay seated. Okay, so then what we're going to do is we're going to go back through those slides when we talked about these movement seekers, and we'll go through some different examples. So maybe the first day I'm going to try a trampoline. So for 5 minutes before the child sits down to the meal, I say, you know, take out the trampoline and you're going to jump for 5 minutes. Okay, and on that particular day, maybe what I see is it was too alerting, the trampoline. It was maybe too intense. The child was excited and restless even more than usual. So maybe it was just too intense. So I'm not saying that for every child trampoline is not a good strategy, it really depends on the kids. I know some children that they do 5 minutes of trampoline, then they sit down and they do schoolwork and they feel really good, and other kids where it's exactly this sort of situation, they're even more excited, even more overwhelmed. So we'll go to the next day. The situation is exactly the same, and what we do is we encourage the child before the meal to try some different yoga positions to kind of, give some muscle stimulation, but in more of a structured way, not just jumping however they want, but they have, a few different poses that they're going to try. And what we see maybe is that the child sits calmly for 5 minutes, but then they start fidgeting again. So maybe we might be saying, okay, so this was maybe just not enough. We kind of wore out the stimulation. So maybe they need a little bit more regular. So maybe the next day we try something else. We give them a deep pressure massage. So again, we're trying to get that proprioceptive stimulation, and we're giving it to them 5 minutes before the meal, and then we're giving it, they have a little break, and we're giving a little massage again midway through the meal, to see if we can kind of increase the duration here. And maybe we see that after each time that I do it, we have 5 minutes of nice and calm. So that's a nice strategy. And then just to continue, problem solving, trial and error, we might try one more. We'll give them one of those air cushions that you guys saw in the pictures of the slides above, to sit on, and they can kind of wiggle around, have this wiggle seat, but stay seating. And maybe for this child, that happens to be the strategy that works out. And for 20 minutes, the rest of the meal, they sit really calmly, with just a little bit of wiggling. So that's essentially how we would use a sensory journal, and we're trying to kind of learn from our experiences and understand, is it that they were doing outdoor play? We didn't even get into that, but is it that they always do outdoor play and they need kind of a calming ritual to get into their meal? Is it, the intensity or the duration of the strategy? So it kind of helps us to see, were there some other stimulations earlier in the day that could have caused problems that we might have put in this precursor antecedent column here. So that's it for sensory journaling, and that's actually it for the presentation. So my references are here. You guys can have a look at them. And there's also some, as I mentioned and as I promised, some helpful resources. You have some websites that are interesting if you have other sensory profiles that you want to explore, and also some books that are really quite helpful. So I'll let you guys, if you have some questions, I'll leave the resources up here. And if you have some questions, now would be the time.
Thank you, KERRI. Thank you for the wonderful presentation. You made it simple, and it's so vast, and yet you made it comprehensive in an hour. So thank you so much. And
I'm very happy.
I'll pose the questions to you. Would you stop the screen share so that we can see you?
Yes, of course, of course.
So the first question is, if the child is hypo to vestibular, what can be done?
Hypersensitive to vestibular information.
Hypo.
Hyposensitive to vestibular information. So this is definitely an area where we want to be cautious, because it's because vestibular information can have an impact on us for a long time. So for those of you that aren't hyposensitive to vestibular information, and you've, like myself, and you've gone on a boat and you felt even 3 hours later that you still were feeling a little bit sick and a little bit, nauseous, can stay with us. So that's just one thing to keep in mind, is that we want to be checking in on signs that the child is overstimulated anytime that we're doing vestibular. So signs can be, their eyes are really, wide open, sweat. It can be, of course, that they can be asking to get off as well. So these are just things that we should check in on. And definitely, if you're doing a lot of vestibular stimulation, I would do it in collaboration with a therapist. That being said, vestibular stimulation activities that we can be doing are things like swinging, spinning, If you're doing it at home, I'm sure you've heard of the activity of, in a blanket with two adults, if you've got two adults around, swinging the child, going, if you have a park nearby or some sort of play center nearby, things like sliding, things like swinging would be really good activities. Even in a desk chair, you can do some spinning activities. So those would be things. And of course, all sorts of exercises where the head is going down. So, climbing on all fours and then getting up and jumping, where we're having the head move in space. You want to be thinking about that. And we're thinking about intensity. Jumping quickly versus crawling slowly, rolls, all sorts of obstacle courses are a fantastic way to do vestibular stimulation. So I hope that gives a few different activities.
Sure, it does. Lots, actually. Okay, so a question from Indu. There is a child who attained toilet control and now she has lost it. She doesn't feel hungry too. It could be is it because of lack of interoceptive senses? Kindly give your suggestions on working with her.
Okay. So as I mentioned before, children that like learn toileting and have some regression, it doesn't necessarily mean that it's caused by poor understanding of their interoceptive information in their body. It can be other reasons as well. So definitely we want to still be using other approaches for teaching toilet training. So things like, visuals or reinforcements and things like that. And possibly if what was used the first time, then I would go back and there's a lot of children that have a little bit of a regression in toilet training. It's not always a perfect, straight graph when we think of toilet training. If, however, if we're really saying, I do think that it's interoception, depending on the child's understanding, what we really want to try and do is give them cues of their body. So you might, set a timer, and before, we have the tendency, sometimes in toilet training, we set a timer and we're going to take the child, every however many minutes. But before we just take the child, we want to try and talk them through understanding what's going on. So try and ask them, does it feel full? Does it feel, like there's too much water in your tummy or in your bladder, depending on the words that you're using. Try and have them notice, kind of feel on their stomach. If they push in different places, do they start to feel it? And try and cue them into how they're going to recognize themselves, those sensations. And for hunger as well, before eating, you might have them try and think about their tummy. How does it feel? Is there noises from their tummy? Give them cues so that they can pick up on this sense that they're not getting enough information from.
Okay. Thank you. I'm just going through. So there is a child who removes removes socks throughout the year. I think it should be who does not remove socks throughout the year.
Or maybe all year long, regardless of how cold they are, they're removing.
Yeah, they don't remove the socks, whether they're cold or they're not cold. I mean, they keep their socks on.
Okay.
And the reason for it and what can we do?
Okay, so one thing I'll just mention before addressing this that I wanted to mention before, and it slipped my mind. One thing to think about is, why do we want to change a sensory behavior? Okay, because sometimes we get caught up on, this child refuses to wear that specific pair of pants, or this child won't eat this one single vegetable. Sometimes it's not something that is impacting on their day-to-day life. It's not something that's preventing them to do what they need to do. And sometimes we can just say, you know what, it's a preference that they have. I prefer to wear this kind of clothes, and it's fine, and I'm still able to function in my day-to-day life. So one question to ask in this situation would be, if they're not removing their socks, is it having an impact? And sometimes it does. I will agree. There's sometimes situations where, we need to take off our socks for whatever reason it is. In some environments, it's, bare feet. If we see that for this particular child, it's not just that they're not removing their socks, but they don't remove their socks because they will not touch certain textures with their hands. So they will not put their foot on a, in sand. They will not. If we start to see that it's not just that, but that, they even won't walk, even in their socks, they won't walk in the park, or they won't, then we start to see, okay, it's preventing them from playing in the park. It's, preventing them from being able to go swimming because they won't take their socks off. If we start to see problems like that, then we might look at some strategies for desensitization. Desensitization in this situation might be to different textures on the feet. So maybe you would do specific activities where, you have an obstacle course, and part of the obstacle course, even if it's through their socks, the child has to walk on bumpy, on rocks or on different textures. Whatever you have, I've seen pieces of paper where you glue different textures on that they would need to walk on, and building up their tolerance so that they can cope with a little bit more stimulation. And then eventually getting to, with no socks on for maybe 2 seconds, they touch something with their foot, and then we put the sock back on. So you can kind of build up their tolerance.
Exactly. Makes a lot of sense. Okay, so if a child behaves more silly, laughing while playing with other kids, is it a kind of sensory issue?
So it's so interesting that you asked that question, because I had mentioned self-regulation can be very linked with sensory processing. So my short answer is maybe. It's possible. There can be lots of reasons why children are silly, and sometimes it's more the motivation of making other people laugh, the socialization, getting the attention, but also it can be, for some kids, it can be a hard time to manage their emotions and to manage their processing, and regulation of what's going on. Next week on Friday, I'm going to be talking about self-regulation, and that might be there. I might talk about some strategies for a child that's more silly. But as to knowing if it's a sensory problem or not, it sounds to me a little bit more on the emotional side of regulation. But there can be lots of reasons for that silly behavior, so it's difficult to answer.
How do you help a child who lacks attention or interest on day-to-day activities like brushing or bathing or playing, while doing activities which we have to always remind him? Is this a part of sensory issue or regulation?
So again, it can be difficult to tease out if something is more behavior or if something is more sensory. One hypothesis or one idea that we can be thinking about is the child not paying attention because they're one of these bystander children that just don't get the information, and so it's not that interesting to them to be bathing. It's just they don't really know what's going on, so they're just kind of passive about it. Is it that they're not getting that information, or is it that they're easily distracted by other information, and so there's too much other information competing, and so it's hard for them to pay attention? It can be a sensory issue. Ways that we can help is definitely to try and look at, you can definitely speak with a therapist and try and look at understanding their profiles in a bigger, full day way, and try and see, are there other situations where they don't really pick up on, what's going on with their hands or what's going on with their body. So while bathing, they don't really notice. While playing, they're kind of a little bit more clumsy. It might be that they're not getting enough stimulation. In that case, during those bathing activities, I might do something where I'm giving a lot of information. So I might not just, do a quick bath, but I might use those massage brushes or the exfoliating brushes to give them lots of information so that maybe they're picking up a little bit more on what's going on, and have them involved in the activity, of course. And like I mentioned, sometimes we can use a sensory approach, but sometimes we're going to use other approaches. So I would still definitely talk about, using rewards, using visual schedules, having the child involved and trying to build skills, set goals where, I'm going to have my child, they have to pay attention for washing their upper body. After that, we'll let it go and I'll help them out, but this is their goal now. So still, I would encourage other strategies as well. It's not just sensory. Okay.
So Shruti asks a question. Can a kid have a combination of profiles mentioned? If so,
Absolutely.
what should we focus first on?
All right. So as I mentioned, and I know that it's tons of information that I give you guys, and maybe you'll be reading through the slides again, but as I mentioned, it's, I would say, common for people to have, to be hypersensitive or more sensitive to certain senses and less sensitive to others. So it's very normal that between different senses, we might have different sensory profiles. And it's also, as I mentioned, it can happen that even within one sense, some children might be sensitive to certain textures on their hands, but not on other parts of their body. It might be part of their body. It might also be the texture. They don't, you know, they're hypersensitive in some situations, hypo. So yes, unfortunately, it's not so clear cut. But the question of where should we start? It depends on how much these profiles are impacting on the day-to-day life. So if you have one of the profiles where, you know, a child is so sensitive to touch that you see it coming up at school, at home, there's tantrums in the morning, at school, there's pushing of friends, they won't play certain activities because, you know, outside they don't want to touch the grass or the sand, whatever it is. If you see that it's really impacting, then even if that child is maybe a little bit also sensitive to light or is a little bit undersensitive to, you know, their body and space, probably I would be going in and working on touch. And it's a judgment call for sure, but I would say, you know, what can we work on that would have the biggest impact on their day-to-day life? What's really preventing them from doing what they need to do? Okay.
Thank you. Any strategies for child who keeps singing, humming, or rhymes all through the day, but sensitive to sound, closes ears to even a name calling or when given instructions?
Okay, very interesting. So my initial reaction when you were asking that question, I was thinking, once again, we have to remember, what is it necessary that we intervene here? Is it, you know, do we have to have the child quiet all the time? Is there a functional impact? And from what I'm hearing towards the end of the question is, yes, there is. And this situation is preventing them from listening to instructions, preventing them from participating. And it's very interesting. There was a lot of information in this question. It's very interesting that you're mentioning the child is okay generating the sound. So when they can control the sound, everything's good. But from other people, then we have that hypersensitivity. So this might be that the child is hypersensitive, but when they can control, they feel comfortable. It might also be that different sounds, you know, they're more sensitive to certain sounds in their environment, but other sounds they don't mind and they even maybe enjoy. And maybe when I'm humming, there's a lot of sound here and it kind of takes out all of that other annoying sound. So it's kind of like a bass, a bass sound or background sound that prevents me from being distracted by all those other noises in my environment. All right, so things that we can do. We can explore and see if part of the reason for blocking the ears and for humming and stuff like that is a protective strategy for hypersensitivity, and we can start doing some desensitization activities. So this might look like, it might look like a few different things. It might look like doing an activity that the child really likes and tends to do relatively well, but with a bit of background noise. So with some music on, gentle music, maybe music that they know already, music maybe with no lyrics, and then building up to kind of more unpredictable sounds, unpredictable noises. I've done activities where I build up to having a conversation with somebody else in the room while the child is doing that game that they enjoy. So we're going to start with something that they find easy, and then work towards developing that, you know, desensitizing to sounds to environments that are a little bit more tricky, like listening to instructions and like doing structured play activities.
So Razia is asking a question. Do children who have seizures often have sensory issues?
It can absolutely be it can absolutely be a situation where children have seizures that are related to specific sensory experiences. So for some children, seizures are brought on by specific visual information, by specific sounds. That can happen for sure. And definitely you would want to be, if it's a child that you're working with, you would want to be checking in on that history and what has tended to cause them. But I don't want to say that all children that have seizures, there's definitely other reasons for seizures as well and other triggers for seizures as well.
Sure, definitely.
It can be sometimes.
Yeah. How do you desensitize a child who's scared of a haircut? Or
yes.
More that of a trimmer than the scissor.
The noise of a trimmer.
The noise of a trimmer, or the noise of a cooker, the whistle of a cooker.
Of a, sorry?
So we have these cookers. These are pressure pans,
Yeah.
and they have a whistle on top.
Yes.
So once the pressure is enough, it whistles out. So it is a very scary thing for many children who are on the spectrum.
Okay, so there's a few different things that we can do. One thing that we want to be thinking about when I mentioned hypersensitivity, the things that we want to try and do are give a little bit of control to the situation. So ways that we can give control to this situation is have the child initiate the activity. So if it's possible, if it's safe for the child to do this, have them, press the button to turn on the trimmer. Even if you're not trimming their hair, if we're not at the level of haircuts yet, just have them get used to hearing the sound, and they can be the one to turn it on and turn it off if that's safe for them. Another thing that you can do is record the sound. So use your phone, record the sound, and have them control turning the sound on and off. So again, it takes away a little bit of that unpredictability. They know when it's going to turn on and off. And you can play around with that until you see that they're at a level of, accepting it, relatively calm, it doesn't bother them. If that's not the case, then you turn the volume down a little bit on your phone, then you help them calm down, you give them more space. But if you get to the level where they can have it on the phone and control it, then you can start working towards the actual sound in day-to-day environments. But as much as possible, we want to give them control, and so that would be more a desensitization. If you're seeing that in the meantime it's still very challenging, you might want to give them a way of limiting the information. So headphones or earplugs if that's appropriate for the child, so that it's not so intense for them while they're developing the tolerance.
Thank you. And this is going to be the last question, I promise.
Okay.
Any strategies for a child putting non-edible in the mouth, like a soap?
Yes. Okay. So there can be, once again, I'm going to say it for the last time, there can be lots of reasons why we see a behavior. It's not always a sensory reason, but for the sake of this situation, we'll say it's not because there's, a lack of nutrients. It's not because there's a lack of understanding. It's really a child trying to meet their sensory needs. We'll just say this for now. So things that we can do, we're thinking that soap is a really strong flavor. So maybe that's a child that's really looking for intense stimulation around the mouth and especially intense flavor. So what we can be doing for that child is making sure that during their meals throughout the day, there's lots of exploring with big and varied flavors. So, we want to be adding different spices, different flavors to their meal. In a situation before they're going to go and encounter some soap, that's where we might want to give them something to occupy their mouth in another way. So maybe something to chew on or something, even a snack beforehand, so that they've got that stimulation. And then we're reminding them that, soap isn't for the mouth. And we're showing them the appropriate thing to do with soap, which would be, for example, to wash their hands. So we want to teach them an alternative. We want to give them an alternative for their mouth, and we want to try and meet that need as much as we can at other parts of the day.
Thank you. Thank you so much. And there are still a few questions, which I'm going to send it to you, KERRI. And then I'll send this feedback back to them by email.
Okay. That sounds
way past our meeting time, and, I don't want to keep you on hold again.
I knew that this topic would go a little bit longer than
That's fine. That's absolutely fine. Thank you, everybody. Thank you, all the participants, for being here. And we'll see you all on 16th for the Lego workshop. Thank you so much.
Wonderful. Thank you.
We'd like to talk to you a little more.
Sure.
Yes, Nisha, we will be sending you the PowerPoint presentation. KERRI, I hope you're able to read the chat. Everybody is appreciating.
Yeah, I was just noting down, and then, oh my gosh, people write such nice things.
I know. It was a wonderful, wonderful presentation.
Thank you.
Because it's huge. The topic itself is huge.
I know.
You know? And
well, and already you've given me 2 lectures to talk about it.
You can go as basic as the basic, and then, you know.
I know.
You guys take 2 years to study SI.
Sorry?
Right? You take 2 years to study sensory integration.
In Canada, it's not so common to do sensory integration therapy. I mean, it's not to say it's not common, but it's not part of the regular schooling sensory integration therapy. It's a little bit, I think in universities, it's taught with a bit of hesitance because the studies and the research behind it isn't as maybe as strong and as
scientific
as some of the other approaches. So they definitely try and focus on approaches that are quite like evidence-based and regularly with a strong basis.
They just approved it, no? Scientific evidence that SI is scientific evidence oriented.
So it's been many years, and there's definitely there's some evidence that supports it, and there's some evidence that doesn't support it, and I think there's a lot of variety because, as I mentioned in the training, there's some different terminology that's being used. So some people are really doing sensory integration therapy, like AIRS sensory integration therapy, and other people are doing sensory-based strategies. And most of what I was talking about today are kind of sensory-based strategies without the background AIRS, whatever criteria. So I think that a lot of the studies, one of the arguments is a lot of the studies aren't really studying AIRS sensory integration. It's mixed, I would say. It's not at a level now. The regulatory bodies that govern occupational therapists, I would say they're not at a level where they're saying everybody should be doing sensory integration therapy. They're saying in some situations it's useful, in some situations it's not. You're going to have to use your best judgment.
I think it's a combination of everything coming together, you know.
Well, that's it, and that's why I strongly believe that some kids have really serious sensory needs, and they really do benefit from sensory-based strategies. But I think it shouldn't be our only tool. I think there's a lot of other tools that we can't forget when we're talking about sensory needs, because it's so involved with our emotions, with our behaviors, that we can't just look at it with a sensory lens.
Okay. So, thank you.
You're so welcome.
Thank you. It was amazing. Right, Madhvi?
Thank you. Thank you, Jasmeet, for standing by for me. Not feeling
oh
too bad.
my God, Madhvi.
Thank you.
You take care, dear. Thank you so much.
You.
We'll see you again. Bye.
All right, guys. Bye-bye. Thanks.
Bye.